So today I feel capping off the end of the day, covering really the role of state plans for Alzheimer's disease and dementia and what is kind of that role of a state plan, and specifically kind of delving into North Dakota state plan that we just recently completed. So the role of a state plan kind of is, the idea is that a state really has done a needs assessment on where are the needs for Alzheimer's and related dementias in the state, and then how will that guide the state in really strategically moving forward and addressing this. One of the things is the importance of it establishing accountability for the state and really looking at what is the successful implementation. Dr. Jurovich was just talking about doing quality improvement plans. And if you think about it, a state plan is sort of doing a quality improvement plan for the whole state. So how do we, put a pin in it and say where we at, and then really keep ourselves accountable for moving forward and what we want to be doing in that, having that effective response moving forward. One of the things is definitely best practice across the country. Since 2007, 49 states, including District of Columbia and Puerto Rico, have done state plans. One of the things that we had found here in North Dakota, though, is, as you will see this map, some of the state plans are older than others. This map is a few years old. I believe this was done in 2018. Some of the state plans were older than others. Here in North Dakota, ours was done in 2007. So we had not had an updated state plan since 2007. So we were getting to the point of kind of falling off the radar, that our state plan really, it wasn't accurate. It wasn't being utilized anymore. It wasn't holding us accountable, which was the purpose of a state plan. So for North Dakota, we really wanted to do this project, and this was done over starting in 2020 through 2022. So over those 2 years, so about a year past completion right now. And so one of the things that we did, wanting to have this development of the state plan, we had this as kind of our guide and our mission statement, was the idea that North Dakota wanted to create an inclusive community and health system that understands, respects, and supports persons who are at risk of, or diagnosed with Alzheimer's and other dementias, and their caregivers. So one of the things, even in doing this mission statement, that was really important was we really wanted to make sure that our plan was including those that were at risk. Or just a bit ago, Dr. Jurovich was talking about a lot of those risk factors and ways that you can do prevention. So wanting to make sure that that population was being included. So one of the things that also came out of partnering with this state plan was the development of a North Dakota specific Alzheimer's data dashboard. So this dashboard is out there. It has lots of different information and facts and figures that you are welcome to utilize this link to go check out. I'm not going to delve too much into the nuts and bolts of the data for the state, but you are welcome to go check that out. But also, one of the purposes of this data dashboard that came out of the state plan was to develop it for it to be out there and available for anybody that was writing a grant, for anybody that was wanting to utilize, any data around Alzheimer's in the state, that was wanting that to be there. So creating this data dashboard through Department of Health and Human Services for it to be available for anybody to use. And definitely a lot of this information, you can see that center fact sheet there is from the Alzheimer's Association. Most of this data is data that comes from the Alzheimer's Association, and then is just specific for North Dakota. So if you're not in North Dakota and you want to be looking at this data for your state, it all is out there and really readily available to find in other states. So that is out there for you. So one of the things, as part of this project, we did do focus groups We ended up doing 12 different focus groups. And then a second part of the project was actually doing a focus group on MHA Nation as well. And part of those focus groups were to identify the themes of the needs in North Dakota. So we really wanted to have that. We had a stakeholder group that had come together and really helped guide us, but these were the main themes that came out of that process. One of the first themes was really, we heard this loud and clear from the stakeholder group, but also from the focus groups, particularly caregivers, was that need for early detection and diagnosis, really wanting to create a system of care that could have a strong system for early detection, diagnosis, really that need for public education campaigns. You just heard Dr. Jurevich talk about, when he was doing mini cog exams as just a provider and the patient kind of going, hey, wait a minute, this isn't what I'm here for. That's part of that, needing that public education, increasing that awareness of the importance of early detection and diagnosis. And then the importance of things like today, training of providers in healthcare settings on the importance of that. So really, we saw that as kind of a primary theme of need that people, really resounded with, was that need for that. And then the next piece was education and awareness. Fortunately, here in North Dakota, we have the Dementia Cares program. We did hear multiple times the benefit of that in our state. Wonderful things were said about the Alzheimer's Association here in North Dakota and their Dementia Cares program, but just the need for there to be more of it. People saying that, by the time they were referred to it, by the time they heard of it, it was almost too late, really wanting to really increase that education awareness. And again, that being across the board, education awareness for, the public, for persons at risk, for family members, providers, just really that general need. And then the third real strong need that came through is that support for caregivers. I know that's been a theme all day today that you've heard, that need for support for caregivers and how important that is. Caregivers need comprehensive supports, and really across the board caregivers, that being professional paid caregivers as those in healthcare settings and that piece, and family members themselves as caregivers. So that piece, I definitely see this. My daughter is a CNA that works in the memory care unit. She actually had a, incident with a resident last weekend, but it prompted her to actually call me at 11 o'clock at night when she got off her shift to say, Mom, I will never let that happen to you. I will be there for you. I promise. So, but she definitely needed that support in that moment. That's why she called me as her mom, was to say, I had a rough time with a resident tonight. And so, that need for caregivers to have support, same with family caregivers. I know that for my family, having dealt with it across the board, family caregivers, we heard that again and again, that, anytime that you have that single patient, the ripple effect of those that are impacted by it. So then the next piece is part of this plan was we collected all these needs and then said, okay, but how would we address these needs? And a big piece of that was, again, the input from the stakeholder group that we had and those focus groups. So we really narrowed it down to these 5 key goals. And the first one being a comprehensive continuum of care, support for research, community and caregiver education, workforce education development, and then identify and address diversity in research, sports, and cares. So I'm going to now go through these individually. So I've said them quickly. But the first was really that comprehensive system of care, really what the GWIP project is all about. Things like today, as Dr. Jurevich said, thank you very much to the planning committee who did a wonderful job of making sure that all different representatives of the care team are represented. Today has been a great cross section of how all the providers involved, the number of people that are on today, but really that need for creating that system of care, and that there was that comprehensive continuum of care. I think really a lot of times people stressed a lot that need for a continuum of care, and feeling that a lot of times the care team or the care did not advance with the individual and would often be disjointed, and really making sure that it was person-centered first and foremost. And that there are comprehensive clinical services throughout all stages of disease. As I said, that care really advances with that individual. Making sure as much as we can that there is access to those services that are local and accessible. So that was something we definitely heard, was the lack of access to any type of specialized services for rural residents, for our Native American population, for those without access to transportation. And so wanting to make sure, how can we make sure that services can be more accessible for those individuals? The need for community supports and programming that supports aging community. You know, this idea of how do we make sure that individuals are able to age in place, and that we have age-friendly communities that are able to manage that. And so that was really all part of that idea of how do we make sure that we have that comprehensive continuum of care that can allow for those individuals to age in place and we're in their community. So the number 2 is really support for research. We did hear a lot about wanting to make sure that there continued to be support for research. But a big piece of that was making sure that there was translation of that research to practice. So again, wanting to, really call out today and the importance of things and events like today, the importance of the Geriatric Workforce Enhancement Project, and, things like our Alzheimer's Association that do so much in translating that research. There is so much research that's happening in this area. It's always changing, but it only is as good as it actually getting out to practice and to those individuals. So really people wanting to make sure that their prescriber or their provider knew the most cutting edge information, knew that, and was able to get that. Wanting to make sure that there was funding for research, but particularly around data sharing and data management, particularly here in North Dakota. How can we be doing a better job of making sure that providers have access to the best data available to them and are able to utilize their data for things like quality improvement projects, for making sure that they're tracking and providing comprehensive system of care? How do we make sure that providers are able to have that, and is there need for funding to do that data piece? So then funding for research around collecting and reporting data that are within those healthy people objectives, wanting to make sure as a state we're continuing to make sure we're collecting that data. So the importance of that in research. Number 3 was, again, we had seen this as a huge need, but then how do we address this need? But that community caregiver education, there really was resounding. We heard it again and again and again, the need for really one-stop shop, for there to be one entity that provides information. It is that kind of end all be all for information of what is available for individuals with Alzheimer's and related dementia. Again, I've called out the Alzheimer's Association. We, as part of this, we heard it again and again, that the importance of the Alzheimer's Association in people's lives. Here in North Dakota, the importance of that Dementia Cares program, and people really wanting to make sure that that program continued. So that was wonderful to hear that we did have something, but also was a big push for the needing to increase funding for that project, wanting to make sure that when we have something that is working well and we see that it could be better, wanting to make sure that that program is able to expand and truly meet the needs. And so that was really kind of part of that. Additionally, there was the idea of creating kind of a web portal for information, all of that information on how to have those hard conversations. Transportation is definitely a really touchy one. When to take the keys away can be a really scary conversation, particularly in a rural community. But really, where is that one point of entry? So that need for that, and particularly, as I said, continuing to support the role of the Alzheimer's Association. And then 4th was that ongoing need for that workforce education development. Again, calling out platforms like this and this important work that's being done today in partnership with UWIP and the Alzheimer's Association, and this ongoing education, but really that importance of education around diagnosis, referral, disease management, but really wanting to put some pressure on existing provider groups such as, our medical association, our state office of rural health, our public health association, on making sure that there is specific education requirements around dementia and dementia care. Wanting to make sure that how do we ensure that providers are getting the information, the continuing education in this area. And additionally, there was a sub piece of that, really wanting to focus on education for professionals that are not in medical, but still work often with Alzheimer's and dementia. So such as, law enforcement, our first responders, but also sales, services, all of those. So other professions that are also working at need for creating kind of that more general information for professionals on working with individuals in this area. Again, any of our residential care facilities, whether they be our memory care units, our skilled facilities, but even our basic care assisted living, on training how to first recognize those signs of symptoms. That was one of the things that there was concern, was that often people don't understand on how to recognize those signs and symptoms. And additionally, making sure that providers have, an understanding on how to provide care for persons throughout the progression of the disease, really being aware, have that education. And then the final, goal was really wanting to make sure that we continue to identify and address diversity in research supports and care access. Really wanting to make sure that we integrate perspectives from diverse cultures whose voices are often not included. So whether that be our LGBTQ population, whether that be our, immigrants, migrants, First Americans, and then also our tribal populations, whether it be on or off the reservation. So wanting to make sure, how do we find ways to really bring those voices forward more and make sure that those individuals are also getting access to the care and the appropriate care that they need. So the kind of the piece of this is, so this is the purpose of a state plan. And as you can see earlier, just about every state has a state plan. North Dakota has one now. And so what can you do about this? Definitely always making sure for advocating for legislation or state agency directives to maintain and update and implement the state plan. One of the concerns was, as I had said earlier, we had a state plan that was done in 2007, and then we didn't update it until 2022. That's quite a long time. And so really wanting to advocate for either legislation or directives within state, the state agency, to make sure that that's done more frequently. And that is a piece of it. Also ensuring that there's a designated state agency that then has a work group that is really leading the implementation on the state plan. One of the things for a state plan is you want it to be a living, breathing document. You don't want it to be something that's like, okay, we did that so we can get our state colored on this map, but now it's done and can get dusty. You actually want it to be something that's used. So here are examples in North Dakota. State agency that oversaw that was Department of Health, now Department of Health and Human Services. Part of that is partnering with like the Alzheimer's Association on seeking out future grants, applying for like a BOLD grant. Helping the state plan was used in helping the Alzheimer's Association go forward and asking for more funding for their programming in the state. So the state plan to really be that springboard to help. And so anybody as a provider really wanting to make sure that you're a part of that. I will say that state plan needs those providers and family members, stakeholders to hold it accountable. And part of that is holding the state accountable. If nobody asks our state agency in 4 years from now, what did you do with this state plan? Then it makes it really easy for the state agency not to do anything with it. But there has to be people asking, what's happening with this? How are we doing this? What's going on? So that can be something you can do. And then definitely, always, as much as you can, advocate for the implementation of state policy changes as recommended in the state plan. So any policy change that can come out of it, in our state, definitely a lot of policy change around, as I said, that need for education, awareness, support caregivers. That is working on establishing that infrastructure and that need for advocating for that funding to continue to support that. that infrastructure.